You are watching the DocTalk show.
So having seen the complications that can arise and how we can test for malaria, so how do we know everybody comes with fever and says there are many people who think that injections are what cuts it for them. People want drips of malaria. What treatments do we have for malaria? We know that in Uganda we've been lucky to access the testing and as well as treatment. So Dr. Darius,
Yes.
what treatments do we have available for I've come with non-complicated malaria. You've done my slide and you tell me you have some scanty or malaria plus has been seen. What treatments do we have for patients with non-severe malaria?
Okay, yes. So but before we go into the treatment, I must emphasize it's always important to first diagnose, to first see indeed that there's malaria, because so many other illnesses can cause fevers, and you have someone taking anti-malarials but they're not getting better. It means there's some other illness apart from the malaria. So
another illness that is developing
that
as
is
you
starting,
treat the malaria.
So you must they must always get a positive test of the malaria, whether it's by that microscope test or by the strip, and it will tell you have malaria, then you start you on treatment.
Sure.
So the treatment depends on how severe the malaria is. There's what they call the non-severe malaria, then it doesn't have the complications, and for such malaria we mainly use tablets. There are different medications which are available. Medications such as Coartem or Duocortexin, these are the commonly used tablets formulations for malaria treatment. So mainly use the oral formulations, the tablets for the non-severe type.
Right.
When the malaria becomes severe, in that we now see signs of the complications which we discussed, there we now have to use the injections, okay? And they're mainly through the vein. They put a needle into the veins on the hands, then they inject the drug directly into the bloodstream, right? And such drugs, they're also common, they're also available in our setting, and you've heard of some such as artesunate or quinine. Yes, those are some of the examples of the treatments
that we get,
which are available.
But under normal circumstances, not just for malaria, I think it's important for people to understand why you would get an injection as opposed to a tablet.
That's right. A lot of course, like Dr. Darius has said, we want to, as we're treating, we are thinking, is this severe malaria? And so do we want to treat it a bit faster so that we can avoid even further complications from happening? So one of the reasons why we give people injectable medications is that you want medication that is going to act very fast, that is going to give you what's called a good efficacy. So you're treating and you know you're going to get results very fast. So that's the most important thing usually when you're looking at severe disease, because you want to make sure that you don't have an ongoing disease process that is going to give even further complications. With non-severe malaria or non-complicated malaria, we've assessed the patient and we're sure that this patient, one, given the level of parasites that they have, but also the symptoms that they have, will be able to, one, tolerate the oral medication, but two, will be able to get better. But it's always important to remember that even if you've gotten oral medications, so tablets to take, and you've been given and you go home and you're not getting better, it's always important to remember to please come back to the hospital, because it could be that actually you're getting severe disease and the oral tablets will not be enough, and we do have to switch to injectable. The other thing that we have to remember is, like we said, sometimes people say, I have malaria and I'm going to go to the pharmacy. It's a bit of a difficult thing, particularly for us in the medical field, because we know that previously we have had drugs that we were using before, and now we can no longer use them because of the resistance that has come up. So
drugs such as chloroquine.
Yes, chloroquine
used to be used, and we abused it because everyone was using it.
Yes,
and the bodies got resistant to it. But we had to come up with
other drugs, right? And every time you come up with new drugs, they're more expensive and all of that. So you want to be able to make sure that, one, you're treating the right disease, like Dr. Darius says, but also that we do not abuse the drugs that we have at that time.
Yeah,
that's very right.
Talking about resistance, the parasite tends to evolve. It develops ways in which it escapes the drugs, and the drugs become ineffective on
It's like criminals
Yes.
and police.
So that's why it's always important. The person, if you are diagnosed with malaria, you must complete the dose.
Yes.
Because there's a tendency people, when they feel better, they don't finish the treatment, but
That's
they must
right.
finish the treatment.
Yes.
So the treatment completely clears all the parasites from the body.
And these malaria parasites, are also like chifesi. They can
They can
hide
hide
somewhere.
somewhere,
yes.
They can see the treatment and hide somewhere, and then come up at a later date when
Yes.
you've stopped your treatment halfway, and they're all not cleared, and then come up again, and
Yes.
then
And
So
still
they
cause
kind of develop
disease.
those mechanisms of where they can resist the drug. So now they have a resistant
That's
form
what
of
we
malaria,
call
which is more
resistance.
Right.
complicated now also to treat.
very, very right. And then for prevention, because malaria you do not really have to get malaria. We can all be able to prevent malaria. That is why you keep hearing campaigns, please sleep under the mosquito net, please do this and this. We have several ways of preventing malaria. Like Dr. Darius mentioned, for the malaria parasite to cause malaria in your body, it needs what we call a vector, a middleman, like how we have farmers, then they sell to middlemen who come and sell expensively to us. So the middleman for malaria is the mosquito. It must go through a mosquito to get to transfer malaria from one human being to the next human being. So in the prevention of malaria, we have what we call vector control, controlling that mosquito, the female Anopheles mosquito that transports this malaria parasite from one person to another. One of the ways we can do this, for example, is by clearing, because the malaria parasite, the mosquitoes
mosquito,
breed in stagnant water, water that is there, that is not moving, and it is clean, and they will just come and stay there and breed
Continue
there
breeding.
and continue getting more and more mosquitoes to cause malaria. So that is one of the reasons we are told, clear any stagnant water that is not moving around your house.
The water in people's homes, you find either they have like open basins or jerry cans which are not covered, or maybe there are some tires that are collecting pools of water. The mosquitoes like such places. Okay, the places where the water just remains still, it's not moving. That's where they like to breed. And also bushy places that have a lot of plantation, bushes that are not cleared, they tend to enjoy such places. These are like the typical breeding places of the mosquitoes. So always remember, to prevent malaria, you have to remove what they call the habitat, the homes of the mosquitoes.
mosquitoes,
Remove
right.
the stagnant water, remove the bushes
the
that are
bushes.
growing around the area. Yes, sun
And that's
can
why we
reduce-
also talk about closing
doors
and
early.
windows
Absolutely.
early. Because this
That's right.
mosquito that transmits malaria normally bites at night. It bites at night when people are in
Sleeping.
drinking places outside, when you're outside telling stories. And that's why we also tell you to dress
With
fully,
long,
long clothes, and cover yourselves so that you do not get in contact with this mosquito.
Right.
We have things like insecticides.
Yes. And those can be either the usual normal ones that you come and spray in the evening, and you've closed your doors and you've closed your windows and you spray that. And you also make sure that you spray corners and hidden areas. So if you have a wardrobe somewhere, make sure you're spraying that. The other thing that you want to do is you may want to use instead what's called indoor residual spraying. So it's sort of, you spray insecticide, but it lasts longer, and so it gives longer protection for the house and for the home.
Like how people do fumigation for
other
cockroaches.
yes.
So there's the residue, the indoor spraying, like fumigation, like we do, but to prevent malaria. To
Yeah, it's
prevent
usually sprayed on the walls, so it kind of sticks there. So in the malaria, when the mosquito flies into the house, it tends to rest on the walls. So when it breathes the insecticide, it can fall down and die.
dies.
So that's how.
And we've seen that the government has been promoting the use of long-lasting treated mosquito nets.
Yes.
These are mosquito nets. That's why these mosquito nets, unlike the previous long mosquito nets we had long ago that were not treated, these are the ones that have treatment in them and chemical in them, that when the mosquito lands on it,
It dies.
Because those days we just had mosquito nets, the mosquito lands on it, it cannot gain access, but it goes to the next person.
Right.
So this one, the mosquito lands on it and it dies. And that's why we emphasize, please sleep under a long-lasting treated mosquito net.
It should be emphasized for those risk groups, especially the
For
young
pregnant
children or
women.
the pregnant women. Always sleep under a mosquito net.
And even in antenatal care, we see that a number of mothers are given mosquito nets,
nets, yes.
for them and for their children below 5 years. For over the past 30 years, We have had research that has gone on because malaria is, like we said, is really one of the leading causes of deaths in Africa. We've had 30 years of research that have gone into the discovery of a malaria vaccine. This vaccine is in its last stages. It has been tried and tested. It has quite a modest, what we call efficacy, a modest reduction of malaria parasites or malaria cases. Must be used in conjunction with the others we've talked about, mosquito nets, with insecticides,
clearing bushes and removing the stagnant water.
And this vaccine is now going to be started in just 3 African countries. We are going to start it in Kenya, in Ghana, and in Malawi. And once this vaccine has shown us that it can be used in the normal settings that we have and reduce malaria in children, we shall be able to hold it. Uganda was one of the countries that asked to have this vaccine come to Uganda first because of our high burden of disease. But unfortunately, we were not chosen as one of the first 3 countries. But we believe that in the near future, this vaccine will be out to help us.
Yes. That would be a great thing, wouldn't it? Because then that means that we now have more arsenal in our prevention. So we're not just now focusing on the usual things of the mosquito nets and the spraying, but now we have a vaccine that we can actually use, particularly for the risk groups.
For the young children.
Yes. So I must emphasize much as the vaccine is there, it's still in the research stages. So we can't roll it out as yet because we still need to test how effective it is. So in the meantime, we need to focus on the measures that have been proven to work. The preventive measures such as the use of mosquito nets or the residual spraying or the clearing the bushes, on top of taking treatment, because treatment in itself is a preventive measure. If you are positive for malaria and you take treatment, the drugs will kill the parasites in your body. That means you won't be able to transmit the malaria if a mosquito is to bite you. So treatment in itself is a way of preventing malaria transmission.
And also preventing the complications from malaria.
Yes.
That's right.
So thank you very much, Dr. Amma and Dr. Darius. And we hope that we can now, each of us can tell who has malaria and what we need to do. And especially if you belong to the risk groups or you have someone you know that belongs to the risk groups. Pregnant women must be tested and treated for malaria. Any child that is below the age of 5 and has a fever, people with sickle cell disease, and people whose immunity has already been compromised by another disease like diabetes, like cancer, like HIV, they need special care. Join us next time on the DocTalk show, and please remember to send in your comments and queries on our social media platforms. We're on Facebook and we're on Twitter. See you next time.